You know, what we're looking at is her upper cervical region. Upper cervical means top two bones. So when we look at this, you can see the divot here, right? You can obviously see the divot here. This spinous portion is also the portion of that second bone. Do you notice from the center of the brain stem, that's what this midline is, do you notice how the spinous is off to the left on the second bone here? Now the problem I have in your case, dear, is how that top bone is sitting as well. Do you notice how that number is bigger on the left? Well, simple math means if it's bigger on that side, one bone went a little bit further that side, right? And so in your case, that top bone pulled left, the second bone rotated left, but the top bone actually rotated backwards. So it's doing this, it's compressing the inside of your brainstem hardcore on that left side. Now, if that top bone rotated forward with it, that'd be much easier to be way less of a complicated neck. In your case, and this is usually what I find, we call this a counter rotation.
Yeah, I'm having neurological symptoms.
Exactly,
Yeah.
and having very serious neurological symptoms from it. So because that top bone shifted left, we're gonna go down to that second image, and I'll show you from underneath why we take this film. This image is really important for us to see rotation of this top bone. We bisect your skull, we bisect that top bone. Like I mentioned, if that second bone went to the left like it did, I would want that top bone to rotate with it, to go forward. Unfortunately though, it went backwards instead. And so when we call these counter rotation misalignments. When we have more of these cause more issues because it's constantly being choked 24/7 in two different directions. And there's almost no way that body can work with it properly because it's just constantly being choked right from the start. So if it doesn't have that proper communication here, it's not gonna have proper communication working itself all the way down for her. Now, obviously we've been talking about some ligament issues, some ligament damage. Absolutely, that's happened. But if you think about it, we are absolutely gonna need to realign that bone properly and gently and get that back in place. And I am gonna need those ligaments to retrain itself properly. That's why I'm gonna have you rest for probably an hour, maybe even an hour and a half, just to make sure those ligaments do get the proper hold and motion, because at the end of the day, we start working on this, your brainstem is gonna clear up, body is gonna start healing, and more importantly, you are gonna start getting better, okay? So with